everybody. It's an honor and a privilege to be here to speak a little bit more about the role of artificial intelligence now for endometriosis. So these are my disclosures. Everybody knows very well about the impact of endometriosis in women's health, not only in terms of the quality of life of patients, but also related to the delay of the diagnosis of the disease. And until recently, the gold standard pattern for the diagnosis of such an important disease was laparoscopy. And it's very difficult to accept this fact, even because 10 to 15% of women may have endometriosis. So we know that we have some challenges in terms of the diagnosis. We have challenges related to the current diagnostic approaches. We have challenges related to the contributed factors that impact the delay of the diagnosis. We know that since this publication that we did with other publications more than 15 years ago, almost 17 years ago, showing the way to map endometriosis with imaging, many things happened towards the imaging to the diagnosis of the disease. At that time, we showed that for deep endometriosis, we had a sensitivity for ultrasound of 98% when the endometriosis compromises the bowel, and 95% when endometriosis compromises the retrocervical region. More studies came showing that it's even possible to do the diagnosis of the disease in the ovaries or even for superficial disease using imaging. And 2 years ago, we came with this publication at the Human Reproduction showing that this is a systematic evaluation of endometriosis by transvaginal ultrasound, showing that this method can replace the diagnostic laparoscopy, mainly for deep and ovarian disease. So this study showed that ultrasound is even better than diagnostic laparoscopy. It has a good accuracy for staging the disease, and also it can replace the concept of the laparoscopy to diagnose endometriosis. So, as I mentioned before, the role of the imaging, now we accept the imaging is the first line modality for the diagnosis. We can use MRI for specific sites of the disease, diaphragm, nerves, or even when the patient didn't have yet sexual intercourse, and or even when the ultrasound for endometriosis mapping is not available in some places, right? And MRI can be a good alternative for this purpose. But what about artificial intelligence? We know that artificial intelligence came with different strategies: data input, pattern recognition, diagnostic support, improving a lot many things in medicine, right? And we know that there are some very potential good applications for artificial intelligence for endometriosis. From the ultrasound AI models, going through the MRI AI models, and also using detection targets, right, as a potential possibility that for us to use AI. We know that in terms of the algorithms that can be used, we can talk about logistic regression, we can talk about decision trees, we can talk about random forests, or even about support vector medicine. But what is important is that the performance of the AI methods is being cited in the literature from 81 to 96% in terms of the sensitivity range, and 70 to 91% in terms of the specificity range. Saying that, obviously the goal is a multimodal diagnosis using AI. Multimodal where ultrasound may play an important role, right? The MRI data also we may have very nice inputs combined, of course, with clinical information for this purpose. So saying that, Why should AI make the difference? It can reduce the diagnosis delay, it can improve the symptom monitoring, it can personalize and for treatment optimization, it may be wonderful, and also accelerate research and trials for this purpose. So the application of AI in endometriosis can be divided in the use of AI before the surgery, during the surgery, after the surgery, and for surgical training or for education purposes. We know that these tools have they may have the potential of enhance the diagnosis, treatment planning, and also patient outcomes for patients with endometriosis. So saying that, how can we envision the use of AI before surgery? And envision may not be the best word, because how can we see this tool being used now for patients with endometriosis? Before the surgery, for patient assessment, for procedure planning, for educational and consent that may be very helpful, and also before the surgery, right, for the patient assessment, diagnosis, procedure planning. All of this may be helpful for this purpose. One of the most important things that must be mentioned here is that the empowerment of the patient can be improved a lot with AI, right? We know that information, symptom tracking, and also decision-making support must be helpful, because if we put the patient in the middle of the decision, AI should be amazing for this purpose, and it's happening now. Who among of you don't see patients that come to their office to say, I saw many things using AI and possibilities, and even imaging, right, using AIs. So another important thing to be mentioned here is the use of AI for models for biomarkers. This is another important issue to be mentioned before the surgery. For biomarker detection, AI may be very helpful to monitor the disease progression, of course, to personalize the treatment using biomarkers, and to predict capabilities in this purpose. It's something that is very relevant. Of course, the recognition of the symptoms is one additional diagnosis tool that AI can provide us, even because the pain pattern analysis is possible if we select the best combination of symptoms to be evaluated, and also using the predicting models in terms of aiming the pre-op evaluation of the patient. We know that there is other issues related to the superior performance that also can be mentioned as well. This is why we have different startups coming, right? Even this startup that we are collaborating a lot is coming for to push the diagnosis of the disease, right? And we have the first results, the first clinical results for this purpose, right? This is a study that we evaluated more than 2,000 patients, right? With the machine learning, right? And with this information, right? We from noise to diagnosis, right? This framework is enhancing a lot the non-invasive detection with patients clinically evaluated. So the machine learning for lesion detection and classification is being very helpful. It excluded in this study 8% of ambiguous cases, right, reducing the false positives. This is a study that is being shown here in this Congress. It had 94, almost 95% of accuracy, right, with a F1 score of 97%, what is amazing for this purpose, and of course reducing the delay of the diagnosis in 4 to 5 years with a very useful, very good platform for this purpose. And this is the way that this information are coming, initially with clinical information, but soon we hope that in not more than 2 months we have information training the machine with imaging, starting from MRI and going to ultrasound afterwards. And during the surgery. Can we use AI during the surgery? Of course, it's also possible to use AI for a real-time AI guidance. That is something to be considered. For anatomic alerts, also to surgeon AI communication, it's possible to make it happen. And for feedback loops, that is something for us to consider. So there are some studies showing that, I saw it's being shown a lot in this Congress here, right? That even situations like this, where we can use AI to identify anatomic landmarks, and for endometriosis for sure, it's very relevant to show nerves, to show vessels, of course, to help a lot and to make this dissection faster for this purpose. What about virtual reality? Virtual reality is another thing to be mentioned. This is a surgery that we did in São Paulo using an Apple Vision Pro, that is one kind of glasses, where we can have all the exams with us, and we can also communicate with colleagues. And this is when during the surgery, I called my friend Mario, and he delayed a little bit to respond, as you can see here, but he came and he participated of the surgery as he was there. He was in Italy, we were in Brazil, right? So this is another possibility that AI can offer us. And even during the surgery, instead for us we can start a Zoom call to transmit the surgery to all over the world and to train people, right, for this purpose. After the surgery, AI can be used for quality control, can be used to discharge summaries, to predictive models, for predictive models, and also for patient follow-up automation. So this is part of the reality. We know that for surgical trainings, we may cite the performance metrics that AI can help us, the certification support, and also simulation with AI feedback. And even for situations like the endometriosis classification of AAGL. This morning, we had a meeting using AI to have the version 2.0 with AI of the endometriosis classification. So this is amazing when we talk about the future that is present. Well, of course, we have clinical implications, reducing the diagnosis delay, improving the target therapies, and also optimizing the surgical planning that is very relevant for us and, of course, for patients, because in terms of symptom presentation, assessment, imaging review, and treatment decisions, the artificial intelligence is something that for sure it's something very, very, very nice for this purpose. And what about the future? Of course, the future for AI is very, very fast, right? We know that the future, it's not anymore years, right? We're not talking about years, we're talking about months, we're talking about a very rapidly evolution. But in terms of the future, we envision the integrated multi-omics data. So you saw many presentations here and in other meetings looking for this. And this is something that AI will be very helpful. Hyper-personalized treatment, that is something that we need to mention. And also for remote monitoring management, as I showed before, it's something that we need to consider when we talk about this. But just to conclude, as it was mentioned before, AI didn't come to replace us. AI came to help us to help patients. We know that for precision pelvic mapping and towards the diagnostic driving mastery, this is something that we should consider strongly nowadays. AI came for guide the excision in terms of the during the surgery, and of course, in the end, to reclaiming women's life. Thank you very much.
Thank you for that innovative presentation.